Hello and welcome to Medical Edge. My name is Todd Barnes. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides you with valuable health information for you and your family.
I'm checking all the time.
When Jennifer Koski gets a symptom, maybe a headache or a rash, she hits the internet to learn more.
There are horrible pictures of rashes online, right? And part of you says, well, thank goodness mine doesn't look like that.
But for people with health anxiety, which Jennifer does not have, the glut of health and medical information on the internet can fuel worries.
Sometimes you assume things are worse than they are because of what you see. And instead of maybe just having it be a little dermatitis, you're thinking, now I have a skin cancer.
It's called Cyberchondria, searching the internet because of illness anxiety, but that searching makes the anxiety worse.
I have worked with individuals who spend 5 to 6 hours a day, every day on the internet.
The worst things you can feed into is you start looking at these symptoms lists. But you start talking yourself into some of the other symptoms, I think, or you worry that you have them.
Instead of being reassured by the information, it heightens your anxiety until you're convinced that something is very, very wrong. Blogs with comments from people who are not health experts, while sometimes helpful, can also be problematic for people with cyberchondria.
You know, if I didn't know better, I might start panicking a little bit about some of the scary things they're saying could be happening and what I should be doing.
Now, Jen's able to keep all this in perspective, but the question is, when does it become a problem for which you need to shut the computer and get some help?
But it needs to be treated. When it gets to the extent that it's governing people's lives, causing them interference with their day-to-day functioning, their roles with their family.
Mayo Clinic psychologist Dr. Richard Syme says that's when it's time to talk to a healthcare professional. He says cognitive behavioral therapy, or CBT, can help break the cycle of searching and calm fears. It involves helping people weigh the evidence that a symptom such as a stomachache is more likely to be a benign condition than a deadly one. It also helps people learn to live with their uncertainty and reassure themselves when they experience distressing sensations or symptoms. And it helps get people off the internet and back into life.
But I'm pretty good about stopping myself and saying, okay, common sense.
But if you can't stop yourself, take Dr. Syme's advice and reach out to healthcare professionals who can help. For the Mayo Clinic News Network, I'm Vivian Williams.
Running was my biggest thing.
Joe Evangelist used to love to run, to work out, to jump on his big Harley Davidson and cruise the open road. He used to.
With the muscle wasting, my hands get tired fast and I can't hang on.
The persistent weakening of his muscles turned out to be ALS, amyotrophic lateral sclerosis. Joe's first instinct was to just hit the gym and try to rebuild his strength.
When I was diagnosed, I was like, I'll go out and work hard and do all this, and they said, no, don't do that.
It's a horrible disease.
Mayo Clinic neurologist Dr. Nathan Staff says there's no cure and no effective treatment.
It's caused by degeneration of neurons that live in the spinal cord, the brainstem, and in the brain, and those neurons control the muscles.
Eventually, paralysis becomes so severe, patients even lose the ability to breathe. That's why Joe volunteered for a clinical trial involving stem cells. Dr. Staff says the Mayo research team collects cells from the patient's own body fat and cultures them in a lab for 6 to 8 weeks until they multiply to as many as 200 million stem cells. Then they're injected into the spinal fluid,
where they don't normally live and are known to secrete factors that may help those neurons live longer. So there are different mechanisms by which stem cells may be helpful for ALS. The avenue that we're pursuing is using the stem cells to serve as a neuroprotective agent.
A ray of hope
Although this is the first phase of human testing for this approach, the hope one day is to slow or completely halt progression of the disease. For the Mayo Clinic News Network, I'm Dennis Doda.
On and after the 4th of July holiday, emergency departments like this one at Mayo Clinic beef up their staff, not just to prepare for firework injuries, but to care for people who get into trouble because they ate too much sodium at holiday picnics.
The ones that are truly at risk are the ones that have heart disease, meaning their heart doesn't pump well, people with heart failure.
Dr. Stephen Kopetsky says sodium raises blood pressure. Here's how. Your arteries are like this hose. Pressure is determined by how much water flows through it. If there's a lot of extra sodium in your system, then there's extra fluid in your blood, which raises the pressure in your arteries.
Can tip you into a heart attack and can tip you certainly into heart failure, where your heart fails to meet the body's demands, can't pump enough fluid, so you get very short of breath.
So what can you eat at that cookout?
I really do not believe in denying oneself.
Dr. Kopetsky says just be smart about it. First, eat small portions, maybe half a hot dog instead of a whole one.
So if you eat a hot dog with the bun, a little bit of ketchup, a little bit of mustard, that's easily 1,100 milligrams of sodium.
And the daily intake for someone with heart issues should be 1,500 milligrams. For those without heart issues, 2,200 milligrams. Second, fill up on fruit and veggies. And third, beware of hidden sources of sodium, such as soft drinks, processed foods, canned goods, cheese, meats, sausage, and breads.
If you go to a hamburger store and you get a hamburger and french fries, there is likelihood more sodium in the bread of the hamburger than there is in the french fries.
Check labels of the types of foods you'll eat beforehand so you're aware of where the sodium's hiding. So sure, take a few bites of Grandma's famous homemade coleslaw you've been craving all season. Just pay attention to what and how much you're eating. For Mayo Clinic News Network, I'm Vivian Williams.
It was very exciting.
Stacy Erholtz has good reason to be amazed. For 10 years, she's battled multiple myeloma, an incurable cancer of the blood. But she's about to undergo a high-tech test that could confirm she's in remission.
I think it's just remarkable. Who would have thought?
Stacy has endured virtually every suitable chemotherapy drug and 2 stem cell transplants, only to relapse again and again. Then, just as she had run out of treatment options, her doctors at Mayo Clinic tried something radical, a single high-dose injection of the measles virus.
Well, it's a very simple concept. Viruses naturally come into the body and they destroy tissue.
And I received enough, apparently, to vaccinate 100 million people, which was alarming, and I was happy to hear that after the fact.
In very simple terms, Mayo Clinic's Dr. Angela Dispenzieri says the measles virus makes cancer cells join together and essentially explode. It then apparently triggers another lasting benefit.
There's some suggestion that it may be stimulating the patient's immune system to further recognize the cancer cells or the myeloma cells and help mop that up more effectively than otherwise.
After more than a decade of work on the concept, researchers say the final breakthrough came in the Mayo Clinic Cancer Center's Gene and Virus Therapy Lab. That's where Dr. Mark Fetterspiel figured out how to make highly concentrated doses of the virus, virtually the same strain of virus used safely as a vaccine.
We've gone in collaboration with the FDA to try to figure out a safe way to do that. I mean, that's their mandate, is to actually support these kinds of trials and applications, but to try to do it safely.
Multiple myeloma patients were chosen to test the concept because they tend to be immune compromised, meaning they can't fight off the measles virus before it has the time to attack cancer cells, and because the disease is incurable, in need of an equally tenacious weapon to fight it.
It really needs to go in throughout the whole bloodstream and circulate to the whole body wherever the cancer cells are hiding.
Particularly in the bone marrow of the skull, ribs, spine, arm and leg bones, and the pelvis. Other than the reappearance of an isolated soft tissue tumor under her skin, Stacy's multiple myeloma remains in check. Dr. Russell says the results are completely changing the game.
We recently have begun to think about the idea of a single-shot cure for cancer. And that's our goal with this therapy.
That's all for this episode of Medical Edge. If you're interested in learning more about any of the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge from the City of Thornton.